Nurse Assistant Practice Exam. Question 1. A resident has an indwelling catheter. The CNA notices the tubing is kinked. The CNA should: Option A, leave it kinked to prevent leakage. Option B, straighten the tubing and ensure proper drainage. Option C, remove the catheter. Option D, clamp the tubing. The correct answer is option B. Straighten the tubing and ensure proper drainage. Kinked tubing obstructs urine flow and can cause bladder distension or infection. Question 2. The CNA finds a resident with a bleeding wound. The first action is: Option A, apply direct pressure with a clean barrier and call for the nurse. Option B, wash the wound with soap and water. Option C, apply a tourniquet. Option D, leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 3. The abbreviation HOB means: Option A, head of bed. Option B, hands on back. Option C, hold on bed rest. Option D, history of bleeding. The correct answer is option D. History of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 4. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should: Option A, apply a dry dressing and continue the bath. Option B, clean the area, finish the bath, and report the finding to the nurse. Option C, ignore it, as skin tears are common. Option D, massage the area to promote circulation. The correct answer is option C. Ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 5. The CNA is providing oral care to an unconscious resident. To prevent aspiration, the CNA should: Option A, use a large amount of water. Option B, position the resident on their side and use minimal fluid. Option C, have the resident gargle. Option D, avoid oral care altogether. The correct answer is option A. Use a large amount of water. Side lying position with head turned allows fluids to drain out. In this rotation, A is correct. Question 6. Tuberculosis is transmitted via which route? Option A, fecal oral. Option B, bloodborne. Option C, airborne. Option D, contact with skin. The correct answer is option A. Fecal oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 7. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, have the resident reposition themselves. Option D, wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 8. An external urinary collection device, condom catheter, is applied to a male resident. The CNA should ensure: Option A, the device is tight enough to remain in place without adhesive. Option B, the device is fitted securely but not too tightly, and skin is assessed frequently. Option C, it is changed monthly. Option D, it is left in place without cleaning. The correct answer is option C. It is changed monthly. Proper fit ensures drainage without compromising circulation. Frequent skin checks prevent breakdown. In this rotation, C is correct. Question 9. A transfer belt is applied. Option A. Over bare skin for a secure grip. Option B. Over clothing, snugly around the waist. Option C. Under the arms. Option D. Around the neck. The correct answer is option B. Over clothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 10. When lifting a heavy object, the CNA should hold it. Option A. As far from the body as possible. Option B. Close to the body at waist level. Option C. Above the head. Option D. With arms fully extended. The correct answer is option D. With arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 11. A side rail pad is used to. Option A. Restrain the resident more effectively. Option B. Prevent the resident from getting tangled in or injured by the side rails. Option C. Make the bed look more attractive. Option D. Elevate the resident's head. The correct answer is option C. Make the bed look more attractive. Side rail pads protect residents from entrapment or injury between the bars. In this rotation, C is correct. Question 12. When feeding a resident with dementia who becomes easily distracted, the CNA should. Option A. Turn on the television for stimulation. Option B. Minimize distractions and provide a calm, quiet environment. Option C. Feed the resident in a busy area. Option D. Rush through the meal. The correct answer is option A. Turn on the television for stimulation. A quiet, calm environment helps the resident focus on eating. In this rotation, A is correct. Question 13. The CNA is bathing a resident and notices a red, open area on the heel. The CNA should. Option A. Apply a bandage and continue. Option B. Report the finding to the nurse and avoid pressure on the area. Option C. Pop the blister. Option D. Scrub the area with soap. The correct answer is option A. Apply a bandage and continue. New skin breakdown must be reported. Pressure should be relieved from the area. In this rotation, A is correct. Question 14. The abbreviation INO stands for. Option A. Intake and output. Option B. In and out. Option C. Inspection and observation. Option D. Infection and obstruction. The correct answer is option B. In and out. INO records the balance of fluids consumed and excreted. In this rotation, B is correct. Question 15. The proper technique for opening a sterile package is to. Option A. Open the flap closest to you first. Option B. Open the flap farthest away from you first. Option C. Open all flaps simultaneously. Option D. Tear the package open quickly. The correct answer is option C. Open all flaps simultaneously. Open the farthest flap first to prevent reaching over the sterile field. In this rotation, C is correct. Question 16. The Resident Bill of Rights guarantees all of the following except. Option A. The right to participate in care decisions. Option B. The right to free medical care. Option C. The right to privacy. Option D. The right to voice grievances without retaliation. The correct answer is option C. The right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 17. Rigor mortis is the. Option A. Relaxation of muscles after death. Option B. Stiffening of the body's muscles several hours after death. Option C. Cooling of the body after death. Option D. Pooling of blood after death. The correct answer is option B. stiffening of the body's muscles several hours after death. Rigor mortis is the temporary stiffening beginning about 2 to 4 hours after death. Question 18. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should: Option A, allow the resident to continue eating. Option B, gently remind the family and resident of restrictions and notify the nurse. Option C, take the sandwich and throw it away without explanation. Option D, ignore it since the family brought it. The correct answer is option B. Gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 19. Touch as a form of communication should be used. Option A, with all residents equally. Option B, only when performing tasks. Option C, appropriately and respectfully, with awareness of the resident's comfort. Option D, never, as it violates boundaries. The correct answer is option D, never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 20. When bathing a resident, the water should be changed. Option A, when it becomes cool, soapy, or visibly dirty. Option B, only if the resident requests it. Option C, at the end of the bath. Option D, never, one basin is sufficient. The correct answer is option C, at the end of the bath. Fresh, warm water promotes cleanliness and comfort. Dirty, cool water is ineffective. In this rotation, C is correct. Question 21. How often should dentures be removed and cleaned? Option A, once a week. Option B, daily, preferably after meals. Option C, only when the resident requests it. Option D, monthly. The correct answer is option B, daily, preferably after meals. Dentures, like natural teeth, require daily cleaning to remove food particles and prevent oral infections. Question 22. Post-mortem care includes: Option A, removing all identification tags. Option B, positioning the body in proper alignment and treating it with respect. Option C, removing all personal belongings. Option D, only cleaning the face. The correct answer is option A, removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 23. A resident is crying and seems upset. The best initial response is to: Option A, tell the resident not to cry. Option B, ignore the crying so the resident can have privacy. Option C, sit with the resident and ask if they would like to talk. Option D, immediately distract the resident with an activity. The correct answer is option A, tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 24. A resident who has had a stroke with left-sided weakness should: Option A, keep the left arm immobile. Option B, use only the right arm for all activities. Option C, be encouraged to use the left side as able and incorporate it into activities. Option D, avoid all activity. The correct answer is option A, keep the left arm immobile. Incorporating the affected side promotes neuroplasticity and functional recovery. In this rotation, A is correct. Question 25. The purpose of a complete bed bath is to: Option A, save time compared to a shower. Option B, cleanse the skin, promote circulation, provide comfort, and allow skin assessment. Option C, only wash visibly soiled areas. Option D, discourage the resident from getting out of bed. The correct answer is option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. A bed bath is important for hygiene and allows the CNA to observe the skin for breakdown. Question 26. The CNA is caring for a resident with a pacemaker. The CNA should: Option A, avoid any physical contact. Option B, provide normal care and report any signs of pacemaker malfunction. Option C, keep magnets near the pacemaker. Option D, avoid taking vital signs. The correct answer is option C. Keep magnets near the pacemaker. Routine care is appropriate. Report any dizziness, palpitations, or pulse irregularities. In this rotation, C is correct. Question 27. The correct cuff size for measuring blood pressure is important because a cuff that is too small will give: Option A, falsely low reading. Option B, a falsely high reading. Option C, no reading at all. Option D, an accurate reading. The correct answer is option A, falsely low reading. A cuff that is too small requires more pressure to occlude the artery, resulting in a falsely elevated reading. In this rotation, A is correct. Question 28. A resident repeatedly asks to go home. The best response is: Option A, you are home now. Option B, you can never go home. Option C, tell me about your home. Option D, ignore the request as it is not reasonable. The correct answer is option D. Ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 29. A resident is wandering toward an exit. The best intervention is to: Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C, apply restraints immediately. Option D, shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 30. The CNA is assisting a resident with a walker. The resident should be instructed to: Option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C, lift the walker completely with each step. Option D, lean heavily on the back of the walker. The correct answer is option C. Lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 31. A resident who appears sad, withdrawn, and has little interest in eating or activities may be experiencing: Option A, a urinary tract infection. Option B, depression. Option C, high self-esteem. Option D, a normal aging process. The correct answer is option A, a urinary tract infection. Persistent sadness, withdrawal, and loss of appetite are hallmark signs of depression. In this rotation, A is correct. Question 32. The abbreviation STAT means: Option A, slowly. Option B, immediately or at once. Option C, tomorrow. Option D, as needed. The correct answer is option B, immediately or at once. STAT means an order must be carried out immediately without delay. Question 33. A CNA who receives a subpoena regarding a resident's care should: Option A, immediately provide all requested information. Option B, notify the charge nurse or administrator immediately. Option C, ignore the subpoena. Option D, discuss it with the resident's family first. The correct answer is option D. Discuss it with the resident's family first. Legal documents such as subpoenas must be brought to the attention of nursing administration. In this rotation, D is correct. Question 34. The proper way to dispose of a used needle is to: Option A. Recap it carefully and dispose in a regular trash can. Option B. Break the needle before disposal. Option C. Place it uncapped into a designated sharps container immediately. Option D. Hand it to the nurse for disposal. The correct answer is option C. Place it uncapped into a designated sharps container immediately. To prevent needle stick injuries, needles must be disposed of immediately and uncapped into an approved sharps container. Question 35. The term scope of practice refers to: Option A. The legal limits of the tasks and duties a CNA may perform. Option B. The physical area where a CNA works. Option C. The number of residents a CNA may care for. Option D. The hours a CNA is scheduled to work. The correct answer is option A. The legal limits of the tasks and duties a CNA may perform. Scope of practice defines the legal boundaries of what a CNA is permitted to do based on training and state law. Question 36. An incident report should be completed. Option A. After the shift is over. Option B. As soon as possible after the incident occurs. Option C. Only if a family member complains. Option D. At the end of the week. The correct answer is option A. After the shift is over. Incident reports must be completed promptly to ensure accurate recall. In this rotation, A is correct. Question 37. Oxygen is in use in a residence room. The CNA should ensure that: Option A. Smoking is permitted in the room. Option B. No smoking signs are posted, and electrical equipment is checked for sparks. Option C. The oxygen flow is turned off when visitors arrive. Option D. The resident is left unattended frequently. The correct answer is option D. The resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 38. If a resident is found unconscious on the floor, the CNA should first: Option A. Call for help and check for responsiveness and breathing. Option B. Put a pillow under the resident's head. Option C. Lift the resident into bed immediately. Option D. Run to the nurse's station. The correct answer is option B. Put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 39. When caring for a resident from a different cultural background, the CNA should: Option A. Ignore cultural differences and provide standard care. Option B. Impose the CNA's own cultural beliefs. Option C. Be respectful, learn about the resident's cultural preferences, and incorporate them into care. Option D. Ask the resident to conform to facility culture. The correct answer is option C. Be respectful, learn about the resident's cultural preferences, and incorporate them into care. Culturally competent care respects diversity and individual preferences, promoting comfort and cooperation. Question 40. A resident is on a toileting schedule. The CNA should offer toileting. Option A. Once daily. Option B. Every 2 hours and when the resident requests. Option C. Only at bedtime. Option D. Only after meals. The correct answer is option B. Every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 41. A radial pulse deficit occurs when: Option A. The radial pulse is faster than the apical pulse. Option B. The radial pulse is slower than the apical pulse. Option C. The pulses are equal. Option D. No pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 42. A resident repeatedly screams help, but is safe in bed. The most likely reason is: Option A. The resident is seeking attention. Option B. The resident is experiencing unmet physical or emotional needs. Option C. The resident is being deliberately disruptive. Option D. The resident has been overmedicated. The correct answer is option A. The resident is seeking attention. Behaviors are communication. Persistent yelling may indicate pain, fear, anxiety, or basic needs. In this rotation, A is correct. Question 43. The primary reason for maintaining residence hygiene is to: Option A. Meet state regulations only. Option B. Promote comfort, dignity, and health while preventing infection and skin breakdown. Option C. Keep the CNA busy. Option D. Use up supplies. The correct answer is option D. Use up supplies. Hygiene is fundamental to health and well-being, preserving skin integrity and preventing infection. In this rotation, D is correct. Question 44. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A. Confront the staff member directly. Option B. Report the observation to the charge nurse immediately. Option C. Document the incident and wait for it to happen again. Option D. Tell the resident to ignore the behavior. The correct answer is option D. Tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 45. Which of the following is an example of a CNA committing battery? Option A. Threatening to restrain a resident. Option B. Performing a procedure without the resident's consent. Option C. Verbally insulting a resident. Option D. Leaving a resident's call light unanswered. The correct answer is option B. Performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 46. The CNA finds a resident sitting on the floor next to their bed. The resident says, "I think I slipped." The CNA should: Option A. Help the resident back to bed immediately. Option B. Leave the resident on the floor and call for the nurse. Option C. Have the resident stand up to assess mobility. Option D. Apply restraints after getting the resident up. The correct answer is option B. Leave the resident on the floor and call for the nurse. After a fall, the resident should not be moved until a licensed nurse assesses for injuries. Question 47. A resident with dementia resists bathing and screams. The CNA should: Option A. Force the bath to ensure cleanliness. Option B. Skip the bath without notifying anyone. Option C. Try again later, use a calm approach, offer choices, and report to the nurse. Option D. Call the family to bathe the resident. The correct answer is option D. Call the family to bathe the resident. Flexibility and patience are essential. Forcing care increases agitation. Report refusals. In this rotation, D is correct. Question 48. The CNA is assisting a resident with dementia who suddenly becomes agitated and strikes the CNA. The best initial action is: Option A. Strike back in self-defense. Option B. Step back to a safe distance, remain calm, and call for assistance if needed. Option C. Restrain the resident immediately. Option D. Yell for the resident to stop. The correct answer is option D. Yell for the resident to stop. Staff safety is important. Stepping back removes the immediate threat while maintaining calm. In this rotation, D is correct. Question 49. The first step when a resident appears to be choking is to: Option A. Begin CPR immediately. Option B. Ask, "Are you choking?" and observe for signs of airway obstruction. Option C. Start the Heimlich maneuver without assessment. Option D. Offer the resident a glass of water. The correct answer is option C. Start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 50. A resident is scheduled for a shower but states, "I am too tired today." The CNA should: Option A. Insist the resident must shower. Option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Option C. Bathe the resident in bed against their will. Option D. Document that the resident is uncooperative. The correct answer is option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Residents have the right to refuse care. Alternatives can be offered. Question 51. Oral care for an unconscious resident should be performed with the resident in which position? Option A. Side lying with the head turned to the side. Option B. Flat on the back. Option C. Sitting straight up. Option D. Trendelenburg. The correct answer is option A. Side lying with the head turned to the side. The side lying position prevents aspiration of fluids into the lungs. Suction should be available. Question 52. The CNA is unable to palpate a radial pulse. The next action should be to: Option A. Assume the resident is dead. Option B. Check the apical pulse or carotid pulse. Option C. Document absent pulse and take no further action. Option D. Shake the resident vigorously. The correct answer is option D. Shake the resident vigorously. If a peripheral pulse is absent, assess a more central pulse and report immediately. In this rotation, D is correct. Question 53. A resident tells the CNA, "I am worthless and no one cares about me." An appropriate therapeutic response is: Option A. That's not true, everyone loves you. Option B. Why would you say that? Option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Option D. You shouldn't feel that way. The correct answer is option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements. Open communication. Avoid dismissing feelings or giving false reassurance. Question 54. The chain of infection includes all of the following except: Option A. Infectious agent. Option B. Portal of exit. Option C. Mode of transmission. Option D. Health insurance status. The correct answer is option B. Portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 55. When communicating with a resident with moderate dementia, the CNA should: Option A. Give multi-step complex commands. Option B. Use short, simple sentences and give one direction at a time. Option C. Shout to ensure hearing. Option D. Avoid eye contact. The correct answer is option D. Avoid eye contact. Cognitive processing is slowed. Simple, one-step instructions are more easily followed. In this rotation, D is correct. Question 56. The tympanic thermometer measures temperature from the: Option A. Mouth. Option B. Armpit. Option C. Ear canal. Option D. Rectum. The correct answer is option A. Mouth. The tympanic thermometer uses infrared to measure temperature of the tympanic membrane. In this rotation, A is correct. Question 57. An adult resident has a respiratory rate of 26 breaths per minute. This is Option A normal, Option B bradypnea, Option C tachypnea, Option D apnea. The correct answer is Option A, normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 58. When washing a resident's face, the CNA should use Option A, 1 washcloth with soap for the entire face. Option B, separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C, a scrub brush. Option D, only water, no cloth. The correct answer is Option D, only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct. Question 59. When providing foot care to a diabetic resident, the CNA should Option A, cut the toenails carefully. Option B, soak the feet in hot water. Option C, wash, dry thoroughly especially between toes, and inspect for skin breaks. Option D, apply lotion between the toes to prevent dryness. The correct answer is Option A, cut the toenails carefully. Diabetic foot care requires meticulous skin care. Toenail cutting is done by a podiatrist or nurse. Lotion between toes can cause maceration. In this rotation, A is correct. Question 60. The supine position is when the resident is lying. Option A, on the stomach. Option B, on the side. Option C, flat on the back. Option D, sitting upright. The correct answer is Option B, on the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 61. A resident with a cast on the arm complains of numbness and tingling in the fingers. The CNA should Option A, tell the resident it is normal. Option B, report the complaint to the nurse immediately. Option C, elevate the arm only. Option D, apply heat to the fingers. The correct answer is Option B, report the complaint to the nurse immediately. Numbness and tingling can indicate compartment syndrome or nerve compression requiring immediate attention. Question 62. The CNA is feeding a resident who is at risk for aspiration. The resident should be Option A, lying flat. Option B, sitting upright at 90 degrees with chin slightly tucked. Option C, reclining at 30 degrees. Option D, standing. The correct answer is Option C, reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 63. A seizure is occurring. The CNA should Option A, restrain the resident firmly. Option B, insert a padded tongue blade into the mouth. Option C, protect the resident from injury by moving nearby objects and cushioning the head. Option D, place the resident in a chair. The correct answer is Option C, protect the resident from injury by moving nearby objects and cushioning the head. During a seizure, protect the resident from injury. Do not restrain or put anything in the mouth. Question 64. A resident is at risk for aspiration. The CNA should check the resident's mouth after eating to Option A, ensure no food is left over for later. Option B, check for pocketing of food in the cheeks. Option C, administer mouthwash. Option D, count the number of chews. The correct answer is Option A, ensure no food is left over for later. Pocketing poses an aspiration risk. The mouth must be cleared after each meal. In this rotation, A is correct. Question 65. Dysphagia is the medical term for Option A, difficulty speaking. Option B, difficulty swallowing. Option C, difficulty breathing. Option D, difficulty walking. The correct answer is option B, difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 66. Cyanosis refers to Option A, yellowing of the skin. Option B, bluish discoloration of the skin due to lack of oxygen. Option C, redness of the skin. Option D, paleness of the skin. The correct answer is option C, redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 67. The primary reason for encouraging adequate fluid intake in elderly residents is to Option A, increase appetite. Option B, prevent dehydration and urinary tract infections. Option C, promote weight gain. Option D, reduce the need for toileting. The correct answer is option B, prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 68. A resident with arthritis complains of pain and stiffness. The CNA can help by Option A, encouraging prolonged bed rest. Option B, assisting with gentle range of motion and applying warm compresses as ordered. Option C, forcing the joints through full range of motion. Option D, telling the resident pain is normal with aging. The correct answer is option D, telling the resident pain is normal with aging. Gentle ROM and warmth can reduce stiffness and discomfort. In this rotation, D is correct. Question 69. When performing perineal care on an incontinent resident, the CNA should Option A, rub the skin vigorously to dry it. Option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C, use only water for cleaning. Option D, apply powder liberally. The correct answer is option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 70. Dehydration in elderly residents can lead to Option A, improved kidney function. Option B, confusion, constipation, and urinary tract infections. Option C, increased energy. Option D, weight gain. The correct answer is option A, improved kidney function. Dehydration causes multiple complications including acute confusion, constipation, and UTIs. In this rotation, A is correct. Question 71. A suppository is administered rectally. In what position should the resident be placed? Option A, supine. Option B, left lateral, Sims, position. Option C, prone. Option D, standing. The correct answer is option D, standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 72. A resident with decision-making capacity has the right to refuse treatment, even if it may result in Option A, longer stay in the facility. Option B, death. Option C, additional costs to the family. Option D, all of the above. The correct answer is option C, additional costs to the family. A competent adult resident has the legal and ethical right to refuse any treatment regardless of consequences. In this rotation, C is correct. Question 73. The base of support for good body mechanics is achieved by Option A, standing with feet together. Option B, standing with feet shoulder width apart. Option C, leaning on one leg. Option D, kneeling on one knee. The correct answer is option D, Kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 74. A resident with aphasia has difficulty. Option A, walking. Option B, communicating verbally or understanding language. Option C, swallowing. Option D, seeing. The correct answer is option B. Communicating verbally or understanding language. Aphasia is a communication disorder resulting from brain damage that affects the ability to speak, understand speech, read, or write. Question 75. A resident with diabetes has a prescribed diet. The CNA notices the meal tray does not match the diet order. The CNA should: Option A, serve the tray as is. Option B, hold the tray and notify the nurse or dietary department. Option C, remove the incorrect items and serve the rest. Option D, ask the resident what they want to eat. The correct answer is option D. Ask the resident what they want to eat. An incorrect diet can cause serious harm. The tray should be held until corrected. In this rotation, D is correct. Question 76. The CNA is caring for a resident with a fluid restriction. The CNA should: Option A, give the resident a full pitcher of water. Option B, measure and offer fluids according to the plan, spreading the allowance throughout the day. Option C, withhold all fluids to stay within the limit. Option D, give all the fluid at once for the resident to manage. The correct answer is option B. Measure and offer fluids according to the plan, spreading the allowance throughout the day. Spreading fluid throughout the day prevents excessive thirst while adhering to the restriction. Question 77. The Trendelenburg position is when? Option A. The head of the bed is elevated. Option B. The foot of the bed is elevated, and the head is lowered. Option C. The bed is flat. Option D. The resident is sitting straight up. The correct answer is option C. The bed is flat. Trendelenburg involves tilting the bed so the head is lower than the feet. In this rotation, C is correct. Question 78. The most effective way to communicate with a resident who has hearing loss is to: Option A, face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B, shout loudly into the resident's ear. Option C, write everything down without speaking. Option D, speak rapidly to convey more information. The correct answer is option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 79. Fluid intake that is encouraged for a resident includes all except: Option A, water. Option B, juice. Option C, coffee, caffeinated, in large amounts. Option D, milk. The correct answer is option B. Juice. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 80. The abbreviation PRN means: Option A. Every day. Option B. As needed. Option C. Before meals. Option D. At bedtime. The correct answer is option C. Before meals. PRN, pro re nata, means medication or treatment is given only when needed. In this rotation, C is correct. Question 81. The acronym RACE in fire safety stands for: Option A, run, alarm, contain, extinguish. Option B, rescue, alarm, contain, extinguish. Option C, rescue, alert, close, evacuate. Option D, remove, activate, close, evaluate. The correct answer is option A. Run, alarm, contain, Extinguish. Raise, rescue residents in danger, alarm, pull alarm, contain, close doors, extinguish, use extinguisher if safe. In this rotation, A is correct. Question 82. To best communicate with a combative resident with dementia, the CNA should approach. Option A. From behind to avoid being hit. Option B. Quickly and with authority. Option C. Calmly from the front, using a gentle voice. Option D. With multiple staff members surrounding the resident. The correct answer is option A. From behind to avoid being hit. Approaching from the front reduces startle response. A calm approach decreases anxiety. In this rotation, A is correct. Question 83. The family of a resident in a long-term care facility may experience. Option A. Relief only. Option B. Guilt, grief, and stress related to the placement decision. Option C. No emotional impact. Option D. Immediate acceptance. The correct answer is option C. No emotional impact. Placing a loved one is a major stressor. Families need support from the care team. In this rotation, C is correct. Question 84. A resident has a blood pressure of 88/56 mmHg. This is considered. Option A. Normal. Option B. Hypertensive crisis. Option C. Hypotensive. Option D. Prehypertension. The correct answer is option B. Hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 85. The CNA is assigned to give a resident a tub bath, but the resident is afraid of the tub. The CNA should. Option A. Force the resident into the tub. Option B. Respect the fear, offer an alternative such as a shower or bed bath, and report to the nurse. Option C. Tell the resident the fear is silly. Option D. Skip bathing altogether. The correct answer is option D. Skip bathing altogether. Fear should be acknowledged. Alternative methods maintain hygiene while promoting comfort. In this rotation, D is correct. Question 86. Range of motion, ROM, exercises are performed to. Option A. Strengthen the ability to fight infection. Option B. Maintain joint mobility and prevent contractures. Option C. Increase appetite. Option D. Promote urinary output. The correct answer is option A. Strengthen the ability to fight infection. ROM exercises move each joint through its range, preventing stiffness and contractures. In this rotation, A is correct. Question 87. The CNA can best support a resident's rehabilitation by. Option A. Doing everything for the resident to ensure safety. Option B. Providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C. Comparing the resident to others. Option D. Telling the resident to hurry to build speed. The correct answer is option D. Telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 88. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B. Immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 89. A resident is on a low-sodium diet. Which condiment is most appropriate? Option A. Soy sauce. Option B. Garlic powder or herbs. Option C. Table salt. Option D. Ketchup. The correct answer is option A. Soy sauce. Herbs and salt-free seasonings add flavor without sodium. In this rotation, A is correct. Question 90. The family of a dying resident wants to provide sips of water, but the resident is unresponsive. The CNA should: Option A, tell the family they are harming the resident. Option B, explain to the nurse, who can guide the family on comfort measures like moistening lips. Option C, allow them to pour water into the mouth. Option D, ignore the family's request. The correct answer is option A. Tell the family they are harming the resident. Mouth care and moistening lips provide comfort without aspiration risk. In this rotation, A is correct. Question 91. A resident who is a new admission is crying and refusing to unpack. The CNA should: Option A, unpack the belongings for the resident. Option B, sit with the resident, offer emotional support, and gently explore their feelings. Option C, tell the resident they must unpack before dinner. Option D, leave the belongings and avoid the resident. The correct answer is option A. Unpack the belongings for the resident. Admissions can be traumatic. Emotional support is a critical function. In this rotation, A is correct. Question 92. When removing PPE, the gloves should be removed first because: Option A, they are the most expensive. Option B, they are considered the most contaminated. Option C, they are the easiest to remove. Option D, it does not matter what order is used. The correct answer is option B. They are considered the most contaminated. Gloves are the most contaminated piece of PPE and should be removed first to prevent contamination during removal. Question 93. A resident who is usually talkative and cheerful is found crying. The CNA should first: Option A, tell the nurse immediately without talking to the resident. Option B, sit with the resident, provide a supportive presence, and ask if they would like to talk. Option C, tell the resident to cheer up. Option D, leave her alone and check back after the shift. The correct answer is option A. Tell the nurse immediately without talking to the resident. Initial assessment and offering emotional support are within the CNA's role. In this rotation, A is correct. Question 94. A resident is on a clear liquid diet. Which of the following is allowed? Option A, milk. Option B, strained cream soup. Option C, apple juice. Option D, oatmeal. The correct answer is option C, apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 95. The most common cause of burns in a long-term care facility is: Option A, cooking accidents. Option B, hot water scalds from bathing or spills. Option C, chemical exposure. Option D, electrical shock. The correct answer is option D, electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 96. Passive range of motion exercises are performed when: Option A, the resident can move the limb independently. Option B, the CNA moves the resident's joints without the resident's help. Option C, the resident is walking. Option D, the resident is eating. The correct answer is option B. The CNA moves the resident's joints without the resident's help. Passive ROM means the caregiver performs all movement for a resident unable to actively participate. Question 97. The best way to ensure resident safety during a transfer is to: Option A, transfer alone to promote independence. Option B, use the transfer/gate belt and proper body mechanics. Option C, move the resident quickly to complete the task. Option D, have the resident hold onto the CNA's neck. The correct answer is option C. Move the resident quickly to complete the task. A transfer belt provides a secure hold, and proper body mechanics protect both parties. In this rotation, C is correct. Question 98. The abbreviation ROM stands for Option A, resident on medication. Option B, range of motion. Option C, right of movement. Option D, routine of management. The correct answer is option D, routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 99. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C, have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 100. The CNA is going to take an oral temperature. The resident is drinking hot coffee. The CNA should: Option A, take the temperature immediately. Option B, wait at least 15 to 30 minutes before taking the oral temperature. Option C, take an axillary temperature instead without notifying. Option D, tell the resident not to drink hot beverages. The correct answer is option D, tell the resident not to drink hot beverages. Hot or cold beverages can temporarily alter oral temperature. In this rotation, D is correct.